So amazing that if you've been with my channel, I've been screaming this stuff for years and letting people know I've been getting in trouble with all kind of letter organizations from the AMA, FSBP, all kinds of trouble because I'm spewing this stuff out and letting people know about this. And now that it's starting to come to fruition, everybody's, it's because, it's the way that you said, you were just making us feel stupid whenever no, absolutely not. I'm not falling for that. Don't try to sit there and reverse it on me and make yourself out to be the victim because I was telling you the truth. How are you guys all doing? Welcome to the channel. I am Ty Smith. You're watching my channel, Modern Renaissance Man. I appreciate you guys taking time out of your day to view my content. Make sure that you're following me on the platform you see above and below. Ladies and gentlemen, do not worry about the spelling up there in Rumble. I know it's spelled wrong, but it is spelled right in order for you to find me on Rumble. Make sure you hit this like button right here. That way my content can consistently be recommended to you, and it helps push my content out in the YouTube shadow banning algorithm world, especially on a video like this. Trust me. And if and when you do subscribe to the channel, which we are approaching 450K, make sure you hit that bell notification. That way you will be notified when I post videos. So ladies and gentlemen, this has been something that's been like a huge heart of mine. On my channel, when I first started YouTube, you guys notice that if you go to my channel and you type in, I have a playlist part where it's called health, right? Where I give out information, educational purposes and all that, not your doctor, ladies and gentlemen. Okay. Because, you get in trouble if I'm on here dancing and going along with the rhetoric, then it's all fine and dandy. But if I go against Big Pharma, which I have been, you get in trouble. You go to work, get in trouble. Oh, somebody filed a complaint against you. They saw something you did on YouTube, Ty, blah, 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 blah. Y'all came from my licenses in different states and everything, which is sad. It did not work out because you want to know why? I was not lying. I was not lying from the scenes, from the Fauci, hokey pokey clot shot, from the stuff that's in this food, because I told y'all this is stuff that we learned going through med school, the ABCs and the 1, 2, 3s, right? Anyway, Dr. Peter McCullough, absolutely love this man. This man was like my guru. He was like my mentor. He was like my go-to person when the Fauci, hokey pokey clot shot demic was going around, okay? Knew exactly, broke stuff down to us for the spike protein. Let's see if I had it in here, I would show you guys, because I spoke on stage with them and a brilliant person, Megan, Peter McCullough. I was introduced to him through them. Anyway, he is a cardiologist, a very well-known one. And when this stuff was going around, he was my go-to person. He broke things down. He even gave remedies and different things like that when it came to what you could do when it came to Fauci, hokey pokey clot shot stuff. Anyway, I'm so excited that he's on here. He is a huge voice when it comes to this. He, to me, in my opinion, was one of the leading people that I was getting information from and that I seen based on studies, based on the research that he was doing in real time with real people, that he was helping folks. And I'm telling you right now, wherever you can find him at, especially on X, Dr. Peter McCullough, make sure you get on there. You can find out remedies how to flush yourself from this spike, Fauci, hokey pokey clot shot team. Check this out.
Welcome back. The big fight gearing up between the incoming Trump White House and if he gets the nomination as head of HHS RFK Jr. Let's bring in internist and cardiologist Dr. Peter McCullough. Doctor, it's great to have you on again. What do you make of this? So Pfizer, Eli Lilly, Big Pharma execs go to Mar-a-Lago, try to lobby Trump to ease up on them and the Make America Healthy Again push. But Trump brought RFK Jr. to the meeting. What do you think of all this?
I think it's a good thing, Liz. We need this executive leadership between Big Pharma and the executive branch, Trump and RFK meeting with them. So much to tackle. Topics could have included the cost of prescription drugs, biopharmaceutical safety, the role of the GPO as the middleman, and direct-to-consumer advertising. I hope Trump and RFK do this with the large nutraceutical health and wellness company in order to devise strategies so America can have less of a reliance on drugs.
So it's going to take a lot of work because the drug industry has been accused of exerting a lot of influence over the FDA, CDC, NIH. There's concerns about the safety of vaccines, the food supply, literally making Americans sick. Let's listen to Senator Bernie Sanders. He agrees with Trump and RFK Jr. Watch.
Congress and the FDA have allowed large corporations to make huge profits by enticing children and adults to consume ultra-processed food and beverages loaded up with sugar, salt, and saturated fat. Much of the food that we as Americans are now consuming are making us unhealthy and are contributing to the fact that our life expectancy is significantly lower than that of many other wealthy countries.
You know, so many scientists agree with Senator Bernie Sanders here. They've got an ally to fix this. Is this powerful stuff? What do you think?
Anytime you see the left and the right coming together on a topic where there's consensus, in this case, these unnecessary dyes that are in food.
And I'm so glad he happened to mention the whole deal with the red dyes, folks. This is something that I have kept from my children for the longest. We kept our children as natural as possible. Anyway, I want you guys to pay attention to something right here, because if you think that your government does not lie to you, just listen.
Red 3 has been known to cause cancer in cosmetics, but we still allow it to be put in our food. I don't understand that.
So Red 3, we have a petition in front of us to revoke the authorization for it, and we are hopeful that within the next few weeks we will be acting on that petition, and a decision should be forthcoming.
You know, if we know something's deadly for anybody that ingests it, how do we continue to just study that and not say, hey, enough's enough?
So Red 3 presents an interesting example for us. It is actually known to be cancer in laboratory animals, rats, but the scientific consensus is that the mechanism of carcinogenicity in rats is not applicable in humans. However, under the FFDCA, which is the law that we implement, any chemical that is shown to be carcinogenic in animals or humans, or should I say humans?
He said it out loud. You had it right. He had it right.
Or animals cannot be authorized by FDA. Red dye, because it is known to cause cancer in laboratory animals, should not be authorized.
Well, it was. It was. I'm going to let y'all know something else, because I helped a lot of people out. When the Fauci ouchie hokey pokey was going around, and I told you guys that the word that they used, and I still have the medical information they gave all medical professionals right here, when they were telling us that the Fauci ouchie hokey pokey clot shot is something that was authorized by the FDA, but was not approved. Look. The Fauci ouchie hokey pokey is unapproved. It's unapproved. There is no FDA approved scene for the 19, but it was authorized, but it wasn't approved. Now, what's really interesting in there is that he almost used the same exact type of word. You see, when you think about approved and authorized, you think it means the same thing. It doesn't. It was not approved, but it was authorized for you to have the Fauci ouchie hokey pokey clot shot. Ladies and gentlemen, I just want to throw that little nugget in there to show you that if they did that, what else do you think that they have out there that you may be taking, ingesting, putting on your skin right now, that they know all along that it causes harm to you, period. Back to the show.
In drugs, they're linked to problems with neurologic development in children. Sanders and RFK are on the right track. These aren't necessary. At Wellness Company, none of our products have these unnecessary dyes. Many Americans want them out of the food supply.
Dr. McCullough, talk to us about the neurological problems in children and people from, the food supply from processed foods.
Well, we've had an asymptotic rise in attention deficit disorder, autism spectrum disorder, a whole range of neuropsychiatric problems. Something is going on over the last several decades that's influenced the neurologic development of our children. In my view, we should have an all-hands-on-deck approach, and part of this is a careful examination of the safety of both the water and the food supply.
Why the water supply?
Both fluoride, excessive amounts of fluoride, and aluminum have been linked to neurological development problems.
Dr. McCullough, we're going to stay on the story. That was really interesting what you just gave in your insights there. We appreciate you so much. Merry Christmas to you. It's good to see you.
See what I'm saying? Y'all have that man right there. Y'all have no idea how much information and wealth of knowledge, medicinally speaking, that this man has. I absolutely Love Dr. Peter McCullough. He cares about patients. I love any doctor. If you come across any doctor, I'm not yours, that will tell you and try to give you information for preventative medicine that is pushing you not to be in a hurry to get on pharmaceuticals and things like that, you got a real one. You got a good one. I'm just telling y'all straight up. Anyway, what do y'all think about that new information that came out? It's not new. It's been there for the longest. To me, I feel like this is going to put a target on so many agencies from all the weird stuff that's been going on, guys, from I hate that the man lost his life with United Healthcare to us now starting to pay attention to what we're eating because Americans most of the time do not care and wonder why we got all these chronic illnesses. Guys, I'm an 80s baby. No kid when I was a kid had these cancers and stuff, leukemia and stuff. No kid that I knew of had this. There was obesity, but it was far and few between. And the reason why it was obesity because those kids ate a lot of sweets and junk. And then you seen that their family was fat. But now, like majority, there was no cardiac issues like what we had in kids. There was like none of this autism stuff. There were people who were mentally retarded and we knew they all went to a separate building or something like that. But now, like everybody's almost on the goddamn on spectrum now. Almost every kid is almost on the spectrum. Every kid is ADD. Every kid is ADHD. Every kid has some type of autism. I mean, my God. And yet at the same time, you know that when we went through schooling, we learned that most things that can happen to you, the basics, folks, infection through some sort of cut or something like that and you got infected, absorption through the skin or something like that, through certain glands or membranes, ingestion, you eating it, swallowing it, getting infected inside, inhalation, you breathing it in. It's this amazing that I tell people things like this all the time. Like, how is it that this whole time your baby was healthy? Your baby came out. Your baby's doing good. Then all of a sudden, a month later, they tell you, oh, your child has this. Well, why? How's that? Well, just saying. Mines don't have any of those. None. Yeah. Anyway, that's for another story. The next developing one that I might be doing, guys, and we will be talking about is y'all remember whenever this stuff happened with United Healthcare CEO, right? After that, Blue Cross Blue Shield was denying patients a certain amount of anesthesia after a certain period of time. This is what the stuff that I tell you, I go at this for another video. But yeah, Blue Cross Blue Shield said, oh, we're only going to allow anesthesia for a certain period of time. If y'all go beyond that time, the patient is going to be responsible for the payment of that anesthesia. That is crazy, but it got reversed. That's for another video though. Anyway, let me know what you guys all think about this. What other things do you know about that's in the food that you know is linked to certain type of ailments? Whatever the case may be, leave it in the comments below after this video. Don't forget to do what you guys see in that cloud right there. And if you would like to see the next video that I will be doing in chronological order, it's going to be up here. Variety of things that I do, especially music reactions, will be here. I am Ty Smith, Modern Renaissance Man, hoping and praying that every last one of you have food, shelter, and clothing. And most of all, I pray every last one of you guys are in great health, mentally, physically, emotionally, spiritually. God bless you all through Jesus.